This is a presentation for People's Community Health Center's lesson on bloodborne pathogens and personal protection equipment. Today we'll learn about what bloodborne pathogens are and how personal protective equipment can help prevent exposure. Let's look first at bloodborne pathogens. According to the Occupational Safety and Health Administration, or OSHA, bloodborne pathogens are infectious microorganisms in human blood that can cause disease in humans. There are three main disease-carrying substances. These three are blood, body fluids, and tissue. Note that blood can carry diseases, whether it is wet or dry, and can also be present in vomit, urine, or feces. Methods of exposure to bloodborne pathogens include accidental injury by contaminated sharps, contact with open cuts, nicks and abrasions, and contact with mucous membranes, including mouth, nose, ears, and eyes. Some common airborne viruses are tuberculosis, the common cold, influenza, whooping cough, and measles. Some bloodborne viruses are HIV, hepatitis B, and hepatitis C. While volunteering, please be careful of surfaces that can be contaminated without visible signs. HIV can survive on surfaces at room temperature for at least a week. Please be sure to wash your hands before touching patients. Also, don't keep food or drinks on counters where infectious materials may be present. Now, let's look at personal protective equipment. This type of equipment is worn to protect you. According to the Food and Drug Administration, or the FDA, personal protective equipment is any type of face mask, glove, or clothing that acts as a barrier between infectious materials and the skin, mouth, nose, or eyes. When used properly, personal protective equipment can help prevent the spread of infection from one person to another. Some of this equipment includes gloves, masks, aprons, face shields, gowns, eyewear, CPR pocket masks, and any other type of equipment that may reduce contact with skin or other potentially infectious material. Contaminated items include anything that touches a body fluid. These items are placed in red biohazard containers. Please be sure to place contaminated equipment in the correct location. Ask if you are not sure. If you feel that you may have been exposed, please inform Vince, the Greenmount Avenue site manager, immediately. If he is not at the clinic at the time of exposure, please find another staff member. To prevent exposure, be sure to take universal precautions. Treat all body and blood fluids as potentially infectious. In this presentation, we learned that bloodborne pathogens can exist on any surface and in many types of body fluids. Personal protective equipment is worn to prevent exposure to these types of pathogens. When in doubt, practice universal precautions.